So what are we talking about? So articular cartilage. There'll be a few slides here that kind of describe articular cartilage. I went to Gray's Anatomy, not the television program, but the actual book, Gray's Anatomy, and just kind of poached their definition. And the top one here is just, I think it's really elegant the way it kind of flows. So articular cartilage forms a thin incrustation upon the joint surfaces of the bone, and its elasticity enables it to break the forces of concussion, while its smoothness affords the ease and freedom of movement. Sounds like an ad or trying to sell you something. It's the cartilage that coats your bone. You can read through the rest of these, but it varies in thickness. It gets its nutrients from the surrounding tissues, the fluid in the joint. Sometimes part of it comes from the bone, but there's different things that kind of keep it healthy. But it's basically the cap that coats the end of the bone. When I talk to patients, they don't want to hear the incrustation on the end of their bone. They want to know, what are you talking about? So break it down to bite-sized pieces. I will say, if we went out to a tree, an orange tree, lemon tree, grapefruit tree, and we plucked the fruit off it, or go to the grocery store and buy an orange. You have that orange. If I took that orange out to the parking lot and I rubbed it back and forth really hard across the pavement, eventually I would rub the peel off, right? If I rubbed it hard enough, I'd rub the peel off, and the fruit would be exposed. Well, I just described what happens in an arthritic process. That peel protects the fruit inside. Your articular cartilage protects the bone inside or deep to it. If I go back and grab another orange, and I take a spoon or my fingernail or something, and I just take a piece of it out, right? So I take a divot or a hole out of there, and I hold it up and I look at it and say, well, that's kind of like a chondral defect. So you can have a wear and tear issue where it just kind of goes away over time, or you can have this defect that I actually pluck out of there. And then what happens when you take that first piece out? My daughter's 6. She wants an orange. What will she say? Can you get it started? Yep. Take my fingernail or a knife or a spoon and I get it started. I just take that first little defect and I hand it to her, and with her little 6-year-old finger she can peel the rest of the orange. Same thing happens with our articular cartilage. If you have that chondral defect, that area where it's gone down to bare bone, the surrounding cartilage delaminates or comes off, or becomes loose. So to me that's a great analogy both for arthritis but also for chondral defects. And it just describes what it really looks like. You can look over here if you want to get brainiac with me and look at the layers, that's fine. But they're different layers of the cartilage down to the bone. This is a piece of bone that we took off of a patient's knee. We did their knee replacement. And I just grabbed it and made a video of it so I could show you why I came up with that analogy of the fruit. So that's the articular side right there. If you flip it over, that's the bone side. That's the side we cut. So the peach color stuff down on the bottom here is bone. That's articular cartilage there. So the peach color stuff here is bone, but on the outer edge there is the articular cartilage. It just coats the bone. This happened to be the healthy part of the knee. But that's what it looks like. To me, that reminded me of an orange or a lemon that's been cut in half. So that analogy tends to work pretty well with patients. They understand that part of it. To classify the injury or the wear and tear process, we use this thing called the outer bridge classification system. So grade 0 is normal. Grade 0 is the baseline, that's normal. Grade 4 is the other end of the spectrum where it's completely gone. So 0 to 4 is the grading scale. Grade 1, things start to soften a little bit. Maybe a little swelling, we'll show you a picture of that, but they kind of soften, but it's intact. You look at it and think, yeah, that looks okay. Doesn't look too bad. But it doesn't look quite normal. It doesn't actually feel quite normal. Grade 2 is these partial thickness. So it gets a little fuzzy sometimes, little cracks or fissures that start to grow. So it's starting to break down. It's pretty obvious when you look at it that this is not normal, cartilage. Grade 3 is where that progresses and it gets very thin. And then grade 4 is where it's completely missing. So that's the outer bridge classification. And we kind of talk about that. If we read the op note of an arthroscopy on the knee, they may say there are grade 3 or 4 changes to the medial femoral condyle. This is what they're talking about with that.